Okay, so I think we're going to get started then. And then people will just kind of continue to join as we go on. All right. Hi, everyone. I want to thank you all for coming today. My name is Maddie. I'm the Co-op Alumni Assistant for the Faculty of Health, and I'd like to start today's session with a territorial acknowledgement. I'd like to acknowledge that much of the work of the University of Waterloo takes place on the traditional territory of the Neutral, Anishinaabe, and Haudenosaunee peoples. Our main campus is situated on the Haldeman Tract, the land granted to the Six Nations that includes 6 miles on each side of the Grand River. Our active work towards reconciliation takes place across our campuses through research, learning, teaching, and community building, and is centralized within our Indigenous Relations Office. I'm so excited that you all are here today for our first alumni office hour of the month. Today we are welcoming Whitney Baxter. These office hours are a great way for us to connect alumni with students, which is really important to us in the Faculty of Health. Alumni helps show students all the different paths you can take after university and show that there isn't just one way to use your degree and that it's okay to change your mind. So we hope that these sessions are helpful for you guys. I would like to say, since the point of these sessions is to connect and chat on a personal level, that if you can all turn on your cameras if you're able to, so Whitney isn't talking to a bunch of blank screens, that would be awesome. When we get to the Q&A portion, feel free to use the raise hand function or type in the chat, like I have a question, and I'll keep track of that and we can call on people. I think that's all for housekeeping. So I'll do a little intro for Whitney. Whitney Baxter is a naturopathic doctor currently based in Victoria, BC. Her journey to naturopathic medicine began after working as an exercise physiologist in cardiac rehabilitation. She witnessed the value of the holistic approach to healthcare and understood that each individual's physical, mental, and emotional health are interconnected. As a naturopathic doctor, she understands that health is very personal and everyone is unique. In her practice, she helps people balance their hormones for PMS, irregular periods, cramping, or for those planning to conceive, improve their energy levels, and reduce anxiety. Treatments may include dietary counseling, sleep support, acupuncture, herbal medicine, and/or supplements. She is an associate at the clinic, but runs her own practice within that clinic. I'll now hand the floor or the Zoom call over to Whitney to fill in the details and talk a bit more about her experiences. Everyone, welcome Whitney.
Thank you, Maddie, and good morning, everybody. I remember being an undergrad student and I attended one of these sessions and it really helped clarify things for me. So I hope I can answer some of your questions too. I didn't know what I wanted to do. I had never heard of naturopathic medicine while I was in my undergrad. So I'll kind of walk you through how I got here. And yeah, I'd love to answer questions about anything you have. So I took kinesiology as my undergrad, and my plan was to become a chiropractor. So I knew I loved the clinical setting and I wanted to work with people. I'm a huge people person. But throughout my experience in kinesiology, I realized that the body was so fascinating and interesting. And I wanted to do more than just chiropractic, but I didn't know what that looked like. So I finished my undergrad, still didn't know what I wanted to do, but I kept asking questions. I kept attending things like this and talking to people that I met. And through doing that, I ended up finding a job in cardiac rehab. So I can answer questions about that as well, because that was a really, really great career. I stayed there for years, the whole time knowing that I wanted to keep going in my education, but I didn't know what yet. So as in cardiac rehab, there was multiple disciplines. So there was nutritionists, there were counselors, there was exercise therapists, and there were nurses. And this healthcare model was really, I thought, was very intelligent. And I wish everybody had access to this instead of just those experiencing chronic disease or rehab recovery. And I remember complaining about this to someone, and someone said, "It sounds like you would really like naturopathic medicine." So I said, "What is that?" And I looked into it, and the values sat really well with me. It's a big scope of practice. You have a lot more time with your patient than just 5 minutes. And I can get into more of the details about what I do. Sorry if you hear my baby in the background. My husband's with her and she wants her mom. She's 9 months, so it's a bit of a balance. But Yeah, so anyways, I looked into naturopathic medicine and the values sat really well with me. So I decided to apply. However, fast forward 5 years, it took me 5 years to make the decision to go into the program because it was 4 years of extra schooling. It was very expensive. And it was a commitment because on the other side of that, you then have to start your own business, your own practice. So I wasn't ready when I was, I think, 21, 22. I wanted to make sure that I was like, that was the decision for me. So my partner and I ended up moving to British Columbia, and I continued working in cardiac rehab here, and it was a wonderful experience. I loved it. And the school in BC was a little bit more my vibe. It was a smaller campus, one-on-one. Everybody knew the administration, the students. Like, it was just such a welcoming community. So that's when I decided to apply to this school. There's also a school for naturopathic medicine in Toronto. So I went there as well. And I encourage you to visit the campuses if you can. And then there are lots throughout the United States. So yeah, the program, the naturopathic medical program, was amazing. It was very, very intense. It was like 70-hour weeks. You're working really, really hard, but they support you through it. There's free counseling. There's massage clinic down the street. You get free naturopathic care as you're a student. So it's just like a really holistic program, which is great because you're becoming a holistic doctor. But it was rigorous. So it was like the biomedical sciences and clinical work and the modalities like herbal medicine, acupuncture, nutrition, and physical medicine. So that's like we do chiropractic manipulations as well. So you're trained in a whole bunch of different things, which is amazing. And then at the end of the program, I took a few months off to kind of recalibrate my nervous system. That's when I moved from Vancouver to Victoria on the island. And I started working with a couple. They're a husband and wife. They're naturopathic doctors, and they've been working together in the same space for 36 years. So to me, that was a really good sign. And I was looking for mentorship. There are residency programs in naturopathic medicine, but it's pretty rare, and they're mostly in the States. And I just didn't want to move to the States. So I stayed here and I shadowed them for a few months, and now I have my own practice within their practice. So they're close mentors of mine. So yeah, I can answer questions about starting of your own practice and what that looks like, but basically a day in the life of a naturopathic doctor. It's different every day. It's really, really challenging and interesting, which is what I love. I do a mix of consults. So I meet with people initially for an hour, and we follow up for anywhere from 20 minutes, 30 minutes, 45 minutes, depending on what we're working on together. And then I also do IV therapy, acupuncture, and what else? A whole bunch of different things. So it's a mix of being on my feet, seeing people in person, and charting and prepping, looking at people's lab works, and collaborating with my community. So my job is really interesting and challenging, and I love it so much. So yeah, that's kind of how I got here. And it was a different path than some of the colleagues. Some of my colleagues who decided to go to naturopathic medicine had a naturopathic doctor in their life who really helped them through a health concern or a condition, and it inspired them to want to go that route. And that's amazing. I wish I had that. I had kind of a different way of getting there, but it was great in the end. So that's me, and that's what I do.
Thank you, Whitney. That was great. So we're gonna start the Q&A portion. So you guys can use the raise hand function or just let us know in the chat when you want to ask a question. And if you aren't able to like speak or mute, you can just type it into the chat also. And if you are asking a question, if you could introduce yourself a little bit, just so Whitney knows who she's talking to, that would be great. So yeah. Maybe we could start out by talking about, this is the classic alumni office hour question, a day in the life, or as you said, a day in the life is pretty different every day. So maybe like a week in the life.
Yes, so I'll kind of go through what a typical Friday looks for me. So I have clinic hours in the afternoon. So in the mornings, I pull up my schedule, I look to see who I'm seeing that day. Usually some labs have been updated. So when I work with people, initially, let's say, for example, they're having really bad anxiety. So I listen to their whole story of when this started, what makes it worse, what are your periods like, what is your diet like, what's your exercise like. Obviously, what's going on in the world right now has gotten worse, so on and so forth. So we really dive in. And then what I usually do is I want to order some blood work to see if there's any nutrient deficiencies, maybe underlying infection or something, or if they have irregular periods, we need to investigate hormones. So at that initial appointment, I'm ordering those labs. And then so for follow-up, usually I'm receiving the answers to that piece of the puzzle. So on a Friday morning, I'm sitting down with my patients' information and I'm kind of putting together this big health puzzle, and I'm coming up with a plan that's for them. So my treatment plans are always individualized. So I incorporate a lot of herbal medicine, supplements if there's, let's say, iron deficiency, anemia, or there's some like calming nutrients that I'll use if it's an anxiety case. But I'm looking at this person's allergies, if they have any other medications. So I'm kind of fine tuning their treatment protocol for them. So that takes some time, but it's interesting. And I'm having to like do research and kind of build these treatment plans. And then, so I'll do that for each of my patients. And then I'll go in the afternoon and I'll meet with them one-on-one. We'll talk about it. We'll collaborate on the treatment plan. If that sounds good for them, we'll get started. If they're like, I don't want to take any more supplements, then we'll think of something else. But the bottom line, they always have options, which is really nice. So I'll do that. Usually I'm then running to do an IV for my next patient. So I prep that IV, but that's nice because I get to chat with them and use a skill, which is really nice. I love working with my hands. As you can see, I'm like a hand talker. And then, yeah, so sometimes there's like a few IVs in a row, and then I'll go back in and maybe see another patient. So it's really interesting, and that's never the same week to week. It changes. And some naturopathic doctors have their days set up where it's just IVE days, for example, just acupuncture, and then afternoons are just consultations. And as you probably heard, I have a 9-month-old, so I'm getting back into practice. So my days are shrunk. So I need to kind of cram everything in. Work-life balance, though. So it works well, and it keeps it interesting for me. But yeah, that's the day in my life.
So you just said work-life balance, and Jana, you submitted a question about that. I wonder, Maddie, if you want to read that question out.
Sure, I can read that one out. So it starts with a quote by Alan de Botton. There's no such thing as a work-life balance. Do you agree with this statement? What advice would you give to women who are trying to balance their careers and family responsibilities?
I think there is definitely a work-life balance, but I don't think it's concrete. Like mine changes. I'm lucky that I have such flexibility in my weeks that I build my own schedule. So mine changes. My husband and I will sit down together and say, what's your week like? What's my work week like? How can we cover both needs? And as a naturopathic doctor, you're sitting with a lot of people's stories, which can be very heavy emotionally. So I think it's important for me to be able to ground myself and take the space for myself as well. So I've built in exercise in my weeks and time off and like days of nothing, because I also do all of my own marketing. So I'm on social media. I'm doing a lot of that stuff too. So I need to have days of nothing. So balance for me is how I survive. And then for women having families, I didn't know that I wanted a family because I went back to school when I was 26 and I graduated when I was 31 and then had to get my practice going, which is my baby. Like that was a lot of work. I loved it, but I was able to just throw myself into it. And then having to step back from practice as a naturopathic doctor. So I'm an associate. So I didn't get a maternity leave. I had to kind of have someone come in to cover. So basically I pay rent for a space. So I had to have someone come in to see my patients and cover my rent. So I planned that. So you can plan ahead. You can either save money and you don't need to have someone come in, or you do. In other instances, it depends on your contract, but some of my colleagues are employees, so they get a paycheck and they get they have maternity leave or vacation pay and all those things, but that you're less flexible with your time because you have to, you have an employer. So it depends on what you want, but I think, planning ahead is important. And I know some people who only took 6 weeks off and their partner had the paternity leave or maternity leave. So it depends what works for you. I think that's why we're pregnant for 9 months, because we have some time to really plan ahead and see what you want, what works for you, and then you can always change it, which is really nice. But yeah, I can speak to that more if you guys have more specific questions, but yeah.
Yeah, maybe if you want to talk a bit more about how your experience in the process of starting your own practice and how you decided that that was the path that you wanted to take.
Yeah, so for me, I knew exiting school, I'm sorry if you hear my baby crying, by the way, she's going down for her nap. So at the end of the program, I was exhausted, I'll be honest. That was a lot. Your 4th year, you finish all of your exams, and then you have to write your licensing and board exams. Each province is regulated. It has its own regulating and licensing body. So I had to write board exams, which was a week long. So I was fried by the end of that. So I took some time off, and I knew I didn't want to jump into running, like opening a business and thinking about that. That's just me. I had no experience in it. We had business classes throughout the program, and they were excellent. And there was lots of opportunities to do extra education in this. I just didn't, because I knew I didn't want to focus on that right away. So my whole goal was to find a mentorship and a practice that I could join, which was really nice because I didn't have to worry about any of that. Now I do pay rent, which is not cheap, but I budget for that. And they take care of all of the front desk. So all the booking, all the lab work that has to get sent out and received, any specialized testing that I do. So digestion testing or hormone testing, we have kits that we sell a patient. They take care of that. They take care of supplement inventory, IV therapy inventory. There's a lot of things in a naturopathic clinic. So that's nice. That's all taken care of. A lot of my colleagues have joined clinics where they're the only naturopathic doctor, which is really great because they're really busy and they work with a team of other professionals so they can bounce ideas off of each other. But because of that, they're running their own inventory for supplements and IV things. So it's nice to have control over that stuff. It's just, you just have to slot it into your work weeks. And something I learned past couple of years actually is everybody has a business coach. I didn't know that. So I got one last year and it was a game changer. She helped set up my perspective in a really healthy way, figure out what my values are and how I could align my practice with those, and just basically how to be the CEO of my life, like how to find that work-life balance, how to schedule in, like, this is when I'm going to do marketing. This is when I'm going to prep for my patients. This is when I'm going to focus on my website or tweaks and things. So that was really helpful. And just realizing that I can't do it all by myself was really important. Yeah. So if you guys have any specific questions about that, but the business coach was a game changer. So right now I have my own naturopathic doctor. I have a business coach, I have a counselor, and I have like this team of people that help keep me happy and balanced. And because I am a new mom, so it's a lot of work in a lot of different ways, but there's definitely a lot of expertise out there that can help you do whatever you want to do to just run the business or run the practice that you want to run.
How much of your time, Whitney, is like split up between the business side and running your business, the marketing, web, like all that stuff, versus time that you're spending with patients? And like I'm just trying to imagine how many hours a week you have to work to do all of those things.
So right now I'm in clinic, not very much. I'm in practice only 7 hours a week. because I'm coming back from my like mini mat leave. But I worked out that I probably work 40 hours a week, because with all my patient prep, with all my marketing and clinic, and that's the amount of work I do no matter what, whether I'm in practice, like seeing patients more of that time, and then it would be less on Instagram or marketing or whatever, you know, so it's always different, but that's my capacity and that's how much I choose to work. And it changes. Healthcare comes in fluxes. So at the end of the year, so people have benefits for naturopathic medicine, which is really great. Depends on their plan, can be anywhere from $200 to $500. I think teachers in BC get $800 a year. So that at the end of the year, people are coming in to see me a lot. So I'm always really, really busy, like November, December, and then January, I'm still really busy because people are like motivated and ready to go. And then February and March, it starts to like get really quiet. That same thing happens in the summer too, because people are traveling and on holidays and not booking appointments. So for me, and this is something my business coach helped me, but I plan ahead for those ups and downs. So when I'm really busy and practice, I'm thinking ahead, like, okay, if there's going to be a lull, so I need to push marketing a little bit to keep myself consistently busy, or I just plan to take some time off. And kind of so planning financially for that and mentally for that. So I don't, because that can be really scary if you look at your schedule and you're like, nobody's coming in. But I learned how to like kind of turn up my level of busyness and turn it down, just pushing more marketing, which is really great. So I hope that answers that. So yeah, the nice thing about running my own practice is I can basically, I think someone asked about specializing. I can seek who I want to work with. And initially when I started as a naturopathic doctor, my goal was to work in cardiac rehab because I felt that population, I wanted to help people prevent that onset, and those who had cardiac disease, I wanted to help them with more than just because they're automatically put on a lot of medications. But getting started into naturopathic medicine, I realized that there's a bigger demographic that I feel sometimes there's a gap in the healthcare system, and that's women's health. Anywhere from people like 20 to 35, and then I see a lot of people who are going through menopause as well. There's just no answers out there other than go on the pill and you can do it. Just take an Advil to get through symptoms, and it made me really angry. So I work with a lot of people right now helping with that type of thing, and really how stress and anxiety and burnout manifests in our bodies. So whether that's changing in periods or digestion or sleep, like all of those things, that's kind of what naturopathic doctors are really good at. We help that kind of the body recalibrate and have the tools to be more resilient. We just did a talk on this actually last week. But so we don't say we specialize in anything as naturopathic doctors because there's no like regulatory body for a specialty. So we educate ourselves, we go to conferences, we pay for extra education, and whatever we're seeing a lot in clinic and we're seeing success with, that's kind of what we focus on, I guess we can say. Yeah, so that will always change, I think, in my career, which is a beautiful thing. So I work with 2 naturopathic doctors who have been in practice for 36 years. And he sees a lot of chronic disease, so Lyme disease, cancer, cardiac. And she sees a lot of like diet, menopause, like a lot of women's health. She does a lot of acupuncture. So they're completely different, but their careers have changed and developed into what they love to treat and what they've kind of perfected. So yeah, I think that's what how I see myself going. Some of my colleagues graduated school and they're like, okay, I'm going to be a fertility health clinic. This is what I want to do. Or I'm going to work with, they knew the exact person that they wanted to work with, and they've done that. And some of my colleagues have opened up their own clinics and they're just thriving and what they love to do. I love the variety. And yeah, I think mine will change a lot throughout my career, which that's how I work.
And so speaking of those two doctors that you work with, do you have any advice if someone is looking for mentorships or like how to start that conversation, how to find people to work with?
This is one thing that I learned, like, I think I read this, like looking back, what would I have changed? And is to be, yeah, like ask questions, ask to shadow who you want to be, or ask to shadow a naturopathic doctor. I did that once when I was younger, like I had just graduated my undergrad and I was working, and she never got back to me, and I got really discouraged. And I thought like people are too busy, they don't have time to talk to people like me, but that's not true. She just missed my email. So I kept asking questions and I kept contacting more people, and there was a lot of naturopathic doctors who opened up their door and had me in and let me shadow them and told me everything and how to apply, and they walked me through all the steps. So do that. Yeah, keep asking questions. I've done that for students. I've mentored someone to get into the program, and she's at the campus in U.S. and I mentored her through the application process and then getting started as a new student. And yeah, and I love doing that. So keep asking questions, ask to shadow. I know COVID's been really weird, but hopefully that's relaxing a little bit, that you can go into someone's practice or just even this, like a Zoom call. That's really nice too.
Oh,
Yeah,
hi.
go ahead, Jana.
Yeah, my name is Jana. I'm a nurse and I work in women's health for like almost 7-8 years. And I work with pregnant women with, in acute hospitals. So it's basically gynecology, gyne-oncology, palliative care. So I kind of know this field pretty well. But my question is more about the scope of practice. As you mentioned before, you kind of have lots of you're a nurse, looks like from the skill set that you have, you're a acupuncturist, chiropractor, medical doctor. So I think you probably researched kind of well why naturopathic doctor will be maybe a better fit for you, but how would you compare the practice of a medical doctor, nurse practitioner, physician assistant, or like acupuncturist, for example, as compared to a naturopathic doctor? And my second question, considering that you work almost on the same kind of private practice, fee-for-service kind of basis, like how would you find practice of a private medical doctor is better or worse? What are the advantages and disadvantages of that practice as compared to naturopathic doctor practice? Because it's essentially small business running operation. So yeah, if you can, I know it's a lot, but it's like what you think on that subject.
Now, those are really great questions. And you can help me with that second question a little bit, like help me if I don't answer it. So the first, yeah, as a naturopathic doctor, my scope of practice. So I think of us like, we're like medical doctors, like your family doctor. So we can listen to your health history. We can do physical exams. So if someone is coming in with abdominal pain, I am trained to do a physical exam and recognize if this is an emergency, like something acute that's going on. And at that point, we would send them into the emergency room or direct them on the next steps, because we can't send for imaging or to a specialist. So sometimes I need to say, this is outside of my scope, this is an emergency, these are the next steps. And a lot of the times I'm advocating for people how to get through the medical system, because if they don't have a medical doctor, that means they're calling a walk-in. These are the symptoms I want you to report. Sometimes I'll write up a note too, to say, these are my findings, this is their symptoms, these are the physical exam signs, and this is what I think might be going on and why these tests are indicated. So we're trained in that, and then we're trained how to diagnose, to look at their lab work, their medical history, the physical exams, and then to come up with a diagnosis. So we're medically trained in that sense, but we are private healthcare, and people are paying to come in to not just hear that one symptom, because sometimes it's their diet that the medical doctor in 5 minutes didn't have time to cover. one patient I had was taking way too much vitamin C and was having diarrhea and bad cramping. And her doctor just gave her like Imodium or something because they didn't have time to get into just like the whole health history, right? So we have an hour at least with the patient initially to dive into their whole health history. What's your stress like? What's your sleep like? What's your coping mechanisms like? What supplements are you taking? What pharmaceuticals are you taking? What are your goals? What do you want? What are you looking? So we have time to really dive into everything and then formulate a plan. And then, so this is where sometimes I wear a lot of hats, and it can be a lot. So I really just focus on some tools. So I do acupuncture, botanical medicine, supplements, and then dietary counseling too. Other naturopathic doctors do injection therapies like for pain. There's a whole lot of extra certifications that you can get that I just have chosen not to because it can like really broaden your scope, and that can sometimes feel like a lot. So yeah, there's like the time spent, the broad, like our understanding of what's acute, what's an emergency right now, and then what's, this is something that we can work on together with the change in diet, with a few nutrients, and doing some more lab work to fill in the gaps. And so I hope that answers your first questions about like our scope of practice, and then maybe how we're different from other practitioners. Acupuncturists, they have the expertise in that one field, and sometimes I'll refer to an acupuncturist to kind of for more regular care, but they don't have the training to, and same with chiropractors, to look at blood work and assess for kind of what's going on from a deeper level and make diagnoses with all aspects of health. So I hope that answers your question. I don't really know the scope of practice of nurse practitioners. So I actually looked into that field too before I became a naturopathic doctor, but I don't fully understand their scope to be able to compare that. And then for, private healthcare, you can maybe repeat that question. I'm not quite sure how to answer your second question.
Well, with medical practice, it can be, it depends where you are. Like, usually they start as a private physicians just because to get on a salary, it has to be specific kind of, it's hospital environment. I know ER doctors, they usually on a salary just because how they operate. But to get into like salaried practice, you have to work either in community clinic, which are very rare. It's just a big talk in Canada, around fee for service and unsustainability of that system. So I don't know if community health clinics will be more wider use of that type of system will be in Canada. But for now, it's mostly like private practice, how they start. And then if they work in academic setting, like teaching hospital, they will be on some kind of salary just because they teach residents, right? So they always have some kind of split system, fee for service for their, regular practice, like clinics, and they have salary because they teach, they attached, affiliated with the university. So it can be kind of easier, right? And some physicians have different payment system, like capitation, they get some kind of fee for each patient, and then they don't feel like they have to get like as many patients to have their budget for that month, because as you mentioned, they pay rent, they have to pay for like clerk and taxation on billing. That's very complicated. So that's why I was wondering how, like, if you're familiar with that system and how is it different or comparable to medical doctor's practice, and if the system exists for you, because I don't know, do you have same kind of billing system with the private insurance companies, or I'm just not familiar with that system?
Yeah, so we have, so basically some clinics we don't have direct billing set up. So most clinics do though. So a patient can come in, give us their insurance information, and then we can direct bill their insurance, and then they won't see any bill. Whereas the patient pays, but we give them a receipt with my license number on it, and they submit that to their insurance. And if patients aren't covered by insurance, then they pay out of pocket. So that's the fees kind of billing for naturopathic doctors. And then a lot of people have their lives set up, like you said, so they'll be teachers at the college and they'll get a salary that way, or they will do. And then, like I said, some people are employees at clinics, so they're residents, or they're getting some kind of salary where they'll have like research set up and they have to do marketing or talks in some capacity for that clinic, and then they'll see patients. So it's just like it's different. It depends what you're looking for, but you can really kind of set it up whatever way you want. You don't have to just make money seeing patients one-on-one. You can teach, you can do talks, you can do group settings, you can sell webinars, you can do lots of different things. I haven't been in practice for a long time, so I haven't even really explored all of those things, but yeah. Where you can own a clinic and then have employees and then take splits from them, or associates, sorry. Yeah, so it's kind of open.
Just a follow-up question. What I meant, like fee for service, sort of. So, do you have that kind of system where, for example, like you did IV infusion, that's how much it costs, and that's what you write on the bill? I know the patient will get kind of full bill, like I get from, other similar alternative medicine practices, but like with insurance companies, it goes similarly, like line by line, pretty much, right? I did IV infusion, it costs this much. I did acupuncture, this much. We did discussion about diet, it's this much, right? That's how you deal with. Okay.
Yeah, that's how we do. And for example, if I see a patient for a consult and we happen to do acupuncture, I'll charge them half acupuncture, because it was an add-on. And some insurance companies will only cover consultations. Some will also cover supplements. Some will also cover diagnostic testing. So it just depends on their insurance company, how it's set up. But we give itemized receipts so people can kind of show their insurance.
And can you like charge what you feel like you have to, or there is a book, like you cannot go beyond this amount?
That's a good question. Our provincial association releases fee schedules every year to show a breakdown of average in the community and the suggested rate. So I follow that. But I also so I take that into consideration, as well as what the owners of my clinic are charging, because I want to be on par with them. I don't want to be like the most expensive one because I'm their new associate. So I take that into consideration too. But yeah, so there's that list, which is really nice. And I don't have to be a member of the association. I need to be licensed with the college, so I pay those fees annually. And the association is just something I also pay for to have access to these fee schedules, for example. And then they also release a lot of great continuing education. I need to complete a lot of continuing education every 2 years, which is great, keeps me up to date. And then I have to do, for each certification that I hold, I also have to make sure that I'm reaching those competencies as well. So I hold extra certifications in acupuncture, IV therapy. I have my prescriptive rights, so I can write prescriptions in British Columbia. I can give immunizations, and what else do I have? Ozone therapy. So that's another IV therapy. So for each of those, I have to have either do 50 hours every 2 years of, say, acupuncture, or I need to show that I've done continuing education. So the association has a lot of resources for that, which is really nice. Yeah.
I have more questions, but I'll get other people to speak first.
I'll just say too, is anyone, you can even just like thinking about going into naturopathic medicine? More, I was just saying, part of the program is to preceptor. So once you're in the program, you shadow a preceptor with a naturopathic doctor. So when I did that, I got to see a lot of different practices and how people have set up their business. And like what they do every day, what they specialize in or kind of focus on. So that was really nice. Yeah.
I guess on that same kind of topic, if say someone's trying to make the decision between like traditional med school or naturopathic medicine, like what kind of advice would you give them to help them make that decision?
I would say find people who are working as naturopathic doctors or a medical doctor, shadow them, ask them what they love about their day, what they don't love about their day, how they liked training, because the training is very, very different. The medical system has very rigorous training, but I think there's pros to that because you have a residency. If you want to go farther, you have like so much education and guidance throughout the system, and then there's a job on the other side of that, which is really, really great. So just break that down for yourself and plan that out. And then like for me, for naturopathic medicine, I just wanted to work more in a clinical setting and then have a little bit more flexibility with my days and what I do every day and be able to work with people for longer. So that's just how I wanted to do. And I only wanted to go to school for 4 years and then kind of start practicing that way. So yeah, just kind of look at what the path looks like financially too, because there's differences in what you can get for student loans and all of those things too. So there's lots of different options. Some people even get started in the medical route and then change, or vice versa. I've known people who have become a medical doctor and then went on to become a naturopathic doctor as well, just to have both streams of education. I hope one day there's a world where they are combined a lot more. We're seeing that a lot in BC, where naturopathic doctors and medical doctors are working together in clinics. I think it's a beautiful pairing. I think it's such a good healthcare model because both are so needed for different reasons. But at the end of the day, whatever route you choose, you can practice the whatever way you want, which is really great. A lot of people like me, I kind of work more like a family doctor. I do a lot of blood work and I have access to prescriptions if we need it. So I work a lot like that. And then I add in kind of other things to help people heal and feel well. But a lot of medical doctors are working as functional doctors, right? So they're spending more time with their patients. They're really educated in nutrition and they're having those conversations. So, oh yeah, all I can say is just meet with people and see what you like and what would suit you.
And I guess I'm wondering like what your experience was going to school for naturopathic medicine and like maybe what kind of classes did you take? What were your favorite classes?
Oh man, it was intense, but I loved it. I was like so ready for it. Your first 2 years they're like the biomedical sciences, and the way our school paired them was not just physiology, biochemistry. They didn't break them up into subjects like that. They combined them. So for example, we would be learning about the immune system. So we would learn the physiology and then the anatomy and then lab work that you do and pathology. So they combined it into themes. So like about the skin, about the digestive system, about the heart, like, so these themes, and we got to see it as a whole picture. It was really intense. We had tests every day. We had exams every couple months. We were constantly being examined, and we'd also have cases. So you'd walk into a room and there would be a mock patient with a symptom, and you had X amount of time to work through your diagnose, ask questions, do proper tests, and then there would be like an instructor sitting there grading you, but also giving you pertinent positives of your findings. So those happened a lot, which were terrifying, but they just trained me how to think that way. So that's like you're really heavy in the first 2 years, and then you move more into clinic. So my third year, I was a student in the clinic. So I worked under the fourth year student as kind of their helper. I was called the secondary. So I basically did all the charting and grabbed all of the laundry and everything. But I observed clinic. And then in fourth year, you are the student clinician. So you see patients, you make the decision, but you have a supervising naturopathic doctor to run all your decisions by and help formulate your plan, but you're seeing that patient. And that was amazing. I saw so many different things, and that's when I started really understanding what I loved. And then, yeah, so training was intense. It's 4 years. You got to be ready for it, as anything, though. But it was amazing. Like I said, there was a lot of support throughout that program. It was interesting. Your class becomes your family and will always be my best friends and colleagues. Yeah, and there's like so many great continuing education and conferences, and yeah, you never stop.
Great, thanks. Jana, did you have any more questions that you wanted to ask?
Yeah, so like as I understood, each patient can self-refer themselves, but do you get referrals from medical doctors, or did you, I don't know, did you find some kind of often, or how often do you get conflicts between the strategy that the medical doctor, for example, takes, and then you see the patient and you have to have all this discussion that maybe alternative plan is better? Like, I know it's very tricky question because you practice kind of in both fields, but how does it go? Like, first one is referrals, and second one, if there are any conflicts between different ways, the medical way and alternative complementary medicine way.
I haven't had any referrals from the medical doctor yet, but I'm sure that happens. Anybody can book in. So anybody can book in as long as they're a BC resident. You don't need to be referred to me, but I get a lot of referrals from past patients who have seen me. They refer their friends and family. Yeah, or other professionals like physiotherapists are having a patient and they think something else is going on, so they'll refer them to me. It's getting there with medical doctors though, I'm sure. I think there's a challenge is that they don't really know what we do. And unfortunately, there's some programs where you can go for a weekend course and call yourself a naturopath. So to get like a naturopathic doctor, you need to go through rigorous training, board exams, and be licensed. So I'm constantly having this conversation of what my scope of practice and training is and what I do. So that's just how it is. And we'll get there. We're getting there for sure. But when someone comes in on a treatment plan by their medical doctor, I'm very careful with that. It's happened before where patients have been put on, for example, hormone therapy, and then that person retired, and now no one's managing this person on hormone therapy, and they're having bad side effects, and it's no longer safe or effective. So I'm very careful with not saying that decision was wrong, but just call it's constant informed consent. So this is the research. These are your options. This is your option if you want to stay on it. These are the risks and benefits of discontinuing. These are your alternatives. So always, it's one of the values of naturopathic medicine is doctor as teacher. So we're always teaching the patient what their options are. And yeah. And sometimes it's just tweaking the medical doctor's advice. It's okay, you're on these pharmaceuticals. This is why. Try this as well. This can really help. Yeah. So sometimes just adding on or building or just offering different alternatives, and it's usually up to the patient. But I would never want to have someone come in and throw that protocol into the, because I want to work with that medical doctor. I want to be on good terms with them because you never want to instill like doubt in the patient with their healthcare team. Yeah, we just want to keep educating them as much as we can.
Yeah, I just feel like you're like voice of the nurses, because as a nurse, I feel like we know what's supposed to be done, but sometimes it's hard to convince the doctors or influence
I
them.
know.
But because of your training, I feel like they could listen more, or you can voice it, or you can prescribe, because nurses cannot prescribe. Except in Manitoba, I'm from Manitoba, so nurses there can have prescribing abilities if, in certain areas, and nurse practitioner is a nurse who can prescribe as well. So it's like family doctor, but more like in a more not that advanced, like for chronic diseases, I would say. Nurse practitioner is a family doctor for chronic diseases, sort of. I find some similarities. So, and it's nice to see, like, because each profession, I feel like, fills the gap that medicine, like, traditional medicine cannot fill, just because of how traditional they are.
Yeah. And sometimes, like, they're so evidence-based, which is important for certain things and to be safe, but sometimes the human body can't be reduced into those variables that are being studied because everybody's so different, or all of our physiology is so different. So it's hard to just be so evidence-based. Sometimes we need to, like, take this human being into perspective and kind of work with that. So there's a lot of challenges, and that's why being able to order blood work and look at it through the lens of optimal versus abnormals is really nice. Because if someone comes in with a ferritin, that's their iron stores, of 50, that's technically normal, but if they're exhausted, maybe that person would feel way better with higher iron levels, and a lot of people do. So we can look at it from, like, we just have more time and access to these diagnostic things to really help people feel better instead of just follow guidelines sometimes, which is nice.
Can I have another question? Very quick one. So I know there is we spend more time, I guess, to educate everybody and themselves about indigenous medicine. How much of that traditional medicine you use, or incorporate cultural traditional views in your practice?
I feel like I could get educated on that way more. Like, there's always so much I can learn, but it was very much integrated into our curriculum. So botanical medicine we learn it over the 4 years. And we learn a lot of herbal medicine that were used traditionally on the island, because they're everywhere. There's a lot of herbal medicines here. And we went to learn from Indigenous elders a few times and how they use things. And we went to harvest the plants. We learned about it, like how to honor this plant and give back instead of just taking everything, just take what you need, and how to use it, what they use it for. So there's a lot of books and things that talk about the traditional uses, and there's not always evidence, like I was saying, to back that stuff up. It's been used forever, for centuries. So I do use it that way. If there's nothing to prove otherwise, and the person's not pregnant or is on a pharmaceutical that could potentially interact, I definitely use things that way. But that's the nice thing too. I can make those decisions. I really understand the herbs inside and out and how they're working in the body. But I use that stuff all the time. Could always learn more though. Good questions. Thank you, Jenna. These are great.
Nina, you can go ahead.
Hey, hi Whitney. I just want to say thank you for sharing. It's awesome advice and really interesting. I never knew what that kind of field was like, but I think it's very more specific when it comes, because I feel like if I were to go to my own doctor, they wouldn't get like into like the nitty-gritty details of what's going on within your body. So I think that's a really cool career. So not any questions, but I did want to take a photo. I'm the social media assistant for the Faculty of Health and Kinesiology and Health Science. So I keep up to date with everything that's going on the Twitter account. So I would love to take a picture of this Zoom call to kind of recap what happened today, if that is okay with everybody. So if you're not comfortable being in the picture, that's fine, but it'd be pretty cool. So I'm just gonna count to 3 and then smile, whatever you want, and then I'll screenshot. Okay. Okay, 3, 2, 1. Okay, awesome.
Thanks,
Thank
Nina.
you. No problem.
So we have time for maybe 1 or 2 more questions if anyone has anything that they want to get in before we end.
Well, thank you for your questions today. It was, yeah, it's a really rewarding career. It's different, it's alternative, and I didn't know about it myself when I was going through undergrad and then working in the cardiac rehab world, I think because I was more in the medical side of things, but I'm glad I found it, and we can make a lot of positive change. And yeah, I just encourage you to ask questions. The schools always have orientation days where you can go in, you can be a student for the day and shadow people around and sit in to some of the lectures, which is really great. I did that at both the Canadian schools. So yeah, I just encourage you to look into everything. There's a lot of resources out there.
Great, thank you, Whitney. So yeah, looking at the time, I guess we'll wrap up here. I want to just give a big thanks to Whitney for taking the time to have these office hours today. So thank you, we really appreciate it. Whitney, would you be okay with sharing like your contact info, maybe throwing your email or Instagram in the chat so people can get in contact with you? Yeah, so if anyone has a question that they didn't get the chance to ask, or maybe you think of them later, you can contact her. And one last reminder, there will be a survey that you all get emailed at the end of the session. It takes like 1 second to do. It's really, really fast. So I would love if you guys could fill that out and give us feedback. But otherwise, yeah, thank you all for coming. I hope to see you at some of our other office hours for this month.
Thanks, Maddie. Thanks, Whitney.
Thank
And
you,
everyone else
Maddie.
for joining.